On to today, our presenter today is Dr. Tamara Martin Causey. Dr. Causey grew up in North Carolina and completed a BA in psychology at the University of North Carolina at Greensboro in 1982. After completing a master's degree in counseling with an emphasis in marriage and family therapy, she became a nationally certified counselor and licensed professional counselor in North Carolina. She worked with families, adolescents, and children who were experiencing delinquent behaviors, aggressive and violent tendencies, and emotional difficulties. Her work led her to research and publish in this area and to direct an agency offering treatment for children and adolescents who had been victims of abuse, neglect, and trauma. Community involvement included leading a countrywide initiative to develop mental health services that were culturally sensitive. Although providing leadership for such an initiative, she thought it was beneficial and fulfilling. Dr. Martin Causey yearned to get back to her original focus of working directly with clients, and this led her to go back to school to obtain a PhD in counseling psychology from New Mexico State University. In 2002, Dr. Martin Causey moved to Arizona. And in 2008, Dr. Martin Causey was honored with a Distinguished Alumni Award from New Mexico State University. In areas of professional service, she has served on the board of Arizona Psychological Association and has chaired their legislative and convention committees. In her desire to help psychologists succeed in private practice, she's written and presented nationally on how to grow practice while balancing the business and client aspects. In 2009, she served as president of the practice division of the American Psychological Association and has also presented nationally on many clinical topics. In addition, today on the panel, we also have Anne Blades and Sue Jones, both senior risk management consultants here at MICA. So, Tammy, I wanted to do some scene setting before we began, where we do have a number of questions that have been sent in previously by our insurers out there. But just to set the scene, there are some healthcare providers, physicians who are working in emergency departments and work directly with patients who have COVID-19. There are some who have practices such that they've been able to transition almost completely to telehealth and work from home. So I imagine the levels of stress and how you deal with it may be different depending on whether you're on the front line or you're working from home. Before we start taking questions, can you say a little about the differences and how to take care of yourself if you're one of those working on the front line and you just can't get any letter?
Sure. Thanks, Jeremy. There's a lot of huge differences if you're one who's working on the front line. And what I mean by that is you are working directly with patients who are diagnosed with COVID-19, and if you're in ED as opposed to some other type of setting. And the reason I make that distinction is because of the way the body handles the stress. And if you are somebody who daily, you're in that fight or flight state, which you are if you're dealing with these issues at that level, and your sympathetic nervous system gets activated and just releases the hormones, as you know, and usually for the average situation, it can take up to an hour for those levels to return to normal. But if you're somebody who's working in emergency and you day in and day out, you are dealing with this situation, you never really get that break. It's pretty much continual, even once you get home. And that's the body's way of protecting itself too. So there's nothing wrong with that happening. You just have to realize the way you deal with stress in that situation should be a little different. I remember years ago, I used to volunteer with the Red Cross with disaster response and mental health. And we would work with a lot of first responders. And the models used to be many years ago is you would have debriefing groups, and while people were still in the middle of the crisis, they would have opportunities to talk about it. And in more recent years, we've learned that that's really not the best thing for people when they are in the middle of crisis. That's not the time to try to debrief or talk about it, because that can raise the anxiety levels. And so what does that mean just on a practical level? If you're somebody that you are in that scenario and you don't know when it's going to end, first, lower some of your expectations and realize that your body's going to be in that fight or flight state, and there's a good reason for it. It makes you hypervigilant. It makes you able to react to situations pretty quickly. And it makes you make decisions so much faster than you normally would. And that's exactly what you need to be able to do. And so there's a good reason for you to be in that fight or flight state. But let's say you're going to be in it for a few months. Then your body needs some relief. But what you want to focus on, if that's where you are, is the basics: eating, drinking, sleeping, and some social contact. And you may not be able to sit there and go through a relaxation exercise. You may not be able to sit there and do deep breathing exercises every day. Or you may not be able to go home and turn it off and quit thinking about it and have a good night's sleep. So just expect that you're going to be in that chronic fight or flight state for a while. And if that's true, you need to focus really on the simple stuff: staying hydrated, keeping a routine, eating something. Maybe you don't feel like eating, and so plan your day so that you have certain kinds of snacks or drinks that are nutritious, so that you're getting something in your body, that you're taking care of yourself. And if you sometimes accept, okay, I can do this for the long haul, I'm in this, and I'm going to focus every day on drinking water, staying hydrated, eating small meals throughout the day. It's okay if my body stays in this fight or flight because it's helping me do my job. And I need to be able to sleep. And so it's really important that whatever my schedule is, that I have times in there where I'm getting a good night's sleep, even if I need help with that. Now, that's not necessarily the approach you would take if you are in more of a chronic stressor, but you do have some downtimes to be able to get out of it. And that's going to be the bulk of most of the questions we're going to talk about today. And so I will save a little bit of that as we go through the other questions.
Okay, thanks, Tammy. So move on to our first question. Okay, I'm a physician. I've been caring for sick patients. I come home and take precautions with my work clothes, shower, etc. I've been working long hours and my kids have been hearing all the COVID-19 information. They're afraid I'm going to contract it, and they're afraid I might pass it on to my wife or to them. I try to explain this is what I do for a living and I'm helping the patients, but that doesn't reassure them. Can you give me some ideas of how I can explain or discuss it with them to make them less anxious? And are there any other things my wife and I can do to reassure them or make them less focused on this?
Okay, that's a common experience, and that ties into, it sounds like this is a physician who is on the front lines and may have somewhat of a normal schedule where he or she goes home periodically. And I can see where family would be really worried in a situation like that. Now, I would say one of the first things to do is first look at how old are your children, because how you approach it with an 8-year-old may be very different than how you approach it with a 12-year-old and older. Because in that time period of pre-adolescence is one starts to really develop abstract reasoning. They can look at cause and effect a little bit differently, and they may not believe everything you say to them. They might understand that you're just trying to make them feel better, whereas a younger child is still a little bit more concrete in their thinking, and they trust you, and you can talk to them about the situation and tell them sometimes they don't have anything to worry about because you're doing X, Y, and Z, and they'll accept it. Older ones tend not to accept that. So one of the first things I would do is start with a conversation, let's say with the children, is ask them questions and try to figure out what are they most afraid of. Because you may find out that what they're most afraid of isn't what you thought they were most afraid of. For instance, some of the things, it could be that they're afraid of death, or it could be that they're afraid if you come home and you're there, then we're going to have to stay isolated longer. Or it could be they have a fear of what it would be like to be sick, and it's not death at all, but they're afraid of the experience of being sick. And so if you can just have conversations, open-ended conversations, ask them questions, find out what is the fear. Then once you know what the fear is, you can better talk to them about it. If you know that their fear is about being sick, then you can have a conversation about what that's like, and does it really, how would you help them get through it if that did happen? Now, one of the other things that's going on is they're hearing things from the media about what precautions should be taken, and there's also a lot of mixed messages out there, and that creates anxiety. And so you may be coming home knowing you're doing all the protocols, you're taking all the precautions, and that you're pretty safe. But if they've been hearing something else during the day, then they may still be worried about that. So it might require a little bit of education with them about what precautions you're taking, why that's important, and why it lowers risk, and why that means they don't have to worry about it as much. Now, if they, after those conversations, if there's still a high level of anxiety and you are one that's on the front lines, then one thing to consider, if it helps their anxiety, and I'm not saying this from a medical perspective or this is what you should do to manage COVID, I'm just saying it from a psychological perspective and lowering anxiety in your family, is what some people have done is they've self-isolated within their home, and that's helped their family feel a little bit better about it. Maybe they sleep in a separate room. Maybe they have their family all come in the front door every time they come home, and you come into the laundry room or hallway or whatever you have from your garage, and they never go in there. And that's where you kind of make the transition, you clean up and enter the house, so that you have something that's visible to them, that they understand this is the barrier, and on this side of the wall, everything happens that you're doing. And then once you enter into this room, then you don't have any of the same clothes on. They've visually seen, they know what the process is of what you're doing, and they never come through that area at all. And then maybe you sleep in a separate room and they see that you're always 6 foot from them, even in the house. And try some of those things to see if it might help. This may be a question that maybe you've tried everything and you've got another question. You know, maybe we have more conversations about, or answer some questions about, well, I tried what you said on this one, and that didn't work. And this is the reason they said they're really worried, and we haven't even thought of that. So I'm hoping this will also be a continual dialogue where we can get some of those questions answered. So let us know feedback if you've tried these things down the road and what happens.
Okay.
Cool. Thanks, Tammy. Let's move on to the next one. We're all feeling stressed in my house. I'm sure many of us can go along with this. I'm a full-time physician. My pre-teenage kids are being homeschooled by my recently furloughed husband. Can you please give me some tips to help out with my stressful work-life balance?
Yes, I think this is where a majority of people fall. And this is a chronic stressor that we don't know when it's going to end. And because of the stress that we're having inside of the house, sometimes we're tempted to kind of forget some of the precautions just because we need to get out and we need to just change this up. And do I really need to be working from home? And I think if we look at how do we manage this better at home, it can also be a pretty pleasant experience. It's kind of interesting. I've been doing video sessions with people, and I sometimes, you know, I see physicians too. And so I might be doing a video session with a physician, and the physician says, oh yeah, I've transitioned to telehealth. And it's almost this exact scenario. And then after a while, I see a person walk through the background, and then I see an animal walk through, and I realize, yes, this is stressful. It's very hard to stay focused and do what you need to do when everybody's in the same space. I I would recommend, and it's affecting even your kids, because most of them are still doing school online, and so they still have a job to do too. Just like you may be having a job to do doing video sessions, telehealth with your patients. And first, expect that it's going to be stressful, and expect that some of the communication that goes on is a reaction of people's stress. And we all tend to be at our worst. We regress a little bit to how we've acted in the past under stress, and we think we've conquered that and we've gotten better and we do it better. You get put in this kind of stress and you go back to the way you used to act. So look at that, be aware of it, and pick your battles. And also have family meetings. It's, if you have this question is geared towards pre-teenage kids, then they're old enough that it's good to routinely have a meeting. Maybe every other day you'll have a 10-minute meeting where everybody sits down at the same time, and you talk about what's going well, what isn't going well. Is everybody able to get their work done? Does everybody feel like they have enough alone time? Are you, what are your concerns? And it's kind of like a business meeting that you might have at your office, but it's a family business meeting. And then everybody's focused on it. You get a chance to hear, how can we make this better? How can we change things up so that there's a better balance for everybody? And when you do it that way, everybody's focused on it. And then you can get into some creative problem solving a little bit better than if it just randomly comes up. What we typically do is, the moment of stress is we say something to somebody when either they're distracted or they're busy doing something and they're at their worst, and then it becomes an argument. And so if you have times where you handle that stress together, come up with creative solutions where everybody feels like they're a part of it, then that's going to go a long way. The other thing to really keep in mind is every member of your family is experiencing loss and is experiencing change. And different people handle change and loss in different ways. And if you can frame and look at, what is the loss for each person? Maybe for my kids, it's the loss of their friends. It's the loss of not being able to go to that dance. For older ones, it's the loss of a graduation. And you go through every member of the family and you'll identify something that has been lost by everybody. And even just acknowledging that, of we have losses and we're grieving, and we've all got so much change, we don't know what to do with it. And identify who in your family deals with change the best and who deals with it the worst. And ones who, this is kind of interesting, like people who tend to be closer to the ADHD side of things tend to deal with change and crises in a much better than somebody who needs routine and stability. And so when you're looking at family members, you may want to think about that too. And where do people fall on that continuum? And how can I best help the person if you're the parent that's trying to help the kids? And even just in your partner relationship, realize that you have to have these conversations alone with each other. Maybe physically change things around the house. Everybody needs a little bit of alone time, and it's hard to get it if you're all there together. And what I'm finding is, as people go along and they're accepting the inevitable of their situation, and people I've talked to, even though they're doing telehealth, their practice has been reduced because there's certain procedures, things you can't do over the telehealth, that you can, you have more free time. And how can you focus on using that free time, something that you've always wanted to do that you never had time for, whether it's a hobby or whether it's writing more? It's a good time for reflection. And if you can look at that, build it into your routine every day so that you spend 30 minutes every day doing that too, then I think you'll find that this could be just a very growth building time.
I think, yeah, I think, Tammy, you know, it's interesting that, you know, you talk about kids being homeschooled and you're working at home. Sometimes there's often a sense of guilt that you haven't got enough time to focus on your kids that are also in the house at the same time as you.
Right.
But I think one way around that is we've tried to maintain some sort of sense of normalcy within your daily life, that you eat together, family that stays together, eats together, stays together,
Right.
and movie nights and things like that. That, yeah, I agree. You know, it was great advice. You do need your alone time, but you know, especially with myself, with sort of 2 teenage boys and an older boy as well. You know, they've got lost. They've gone out of their routine, and yeah.
Right, and it's a great time, like what you're pointing out, is to get back some of that family time that's so important.
Yeah.
Keeping the routine. A routine is very important. Jeremy, I am going to step away just for 2 seconds.
Okay.
Because I don't know if you hear it in the background, but there is a dog
dogs.
whining. I'm staying at home too.
The perils of working from home. Yes.
So 2 seconds, I will be right
Okay,
back.
no problem.
You know, Jeremy, something
Hi,
that
Ann.
Tammy brought up was the fact that you can be more creative when you're looking for solutions when you actually have a meeting, which made a lot of sense to me. You know, if you're busy and someone's asking me, well, you know, I don't have time to do my homework or whatever, it's smart to have a family meeting, I guess, and really have the time to think about it versus when you're in the middle of all this trying to throw out solutions when you don't have time to think about them.
Yeah, no, I agree.
Yeah, and you've got so many layers. You basically, everyone in your family has a job, even your kids, unless they're 3 years old. You know, they're doing school, they're doing things. And so in some ways, it's an overlap of business and personal. Yeah. And so there is that business. Think of your family as, well, we all have to maintain business. So we do have to adopt some of these ways of making sure it's working smoothly for everybody. Because nobody has experience with this. When in your life have you ever had to do this?
That's right.
We're all learning.
Right.
Okay, let's move on to the next question. I work in a primary care practice. There's not enough PPE. I'm so worried that a patient will come into the office with COVID-19 symptoms, that I will be exposed and bring the virus home to my family. How can I manage my anxiety during this stressful time?
That's a tough one. You know, the supplies have been in short demand. Nobody expected to have to need all of this. First, if you are in a primary care practice, I would look first at what you have control over and what can you change. And what I mean by that is there may be ways to make this safer for everybody or get supplies that your practice hasn't thought of. At this stage of the game, I kind of doubt that, but early on when everybody was just really scrambling, I heard some really creative ways of handling this. In fact, just as an example, there was one person who was a primary care provider for the elderly. She had a gerontology practice, and she wanted to keep her practice open and see her patients because she knew they would be high risk, and she's trying to keep them out of the hospital, or she could at least provide some screening and not have them go into a setting that might further exacerbate things. But she didn't have any supplies at all. And so she posted on Facebook to our local community, and within an hour, there were cosmetic surgery practices who notified her and said, you can have supplies from our office because we can't do procedures anymore right now. And it was just putting it out there of, we have this need. And there's so many volunteer organizations now, they've kind of mobilized and they're trying to help as much as they can. So I would look at, are there any creative avenues you have access to other than the typical medical supply avenues where you might be able to get what you need, and then you're lowering your anxiety that way. Mm-hmm. But if you've already done that and there's nothing else that you can do, and you're pretty confident that your office is going by all the protocols, everything is the way, it's as good as it gets, and you're doing everything. Then, another level is we have access to what the medical community is doing. Look and see if you need to make any changes in your office, maybe what retail is doing. Do you have adequate shields around your office space where people are working, that kind of thing? And if you've done that and you've got all of that, then start to think about, okay, I've done everything I can. There's nothing else I can change or do. I just have to focus inward and look at my anxiety levels and how do I manage that. And I would start every day before going to work, taking take deep breaths, breathing in, counting to 8, holding it a couple seconds, breathing out, where you're focused in on your body, and then you're telling yourself that I have done everything I can. We're taking the recommended precautions. I'm getting ready to go to work, and today is going to be a good day, and I'm not going to let anxiety make me feel worse than I am about things that are going on. And take several breaks during the day and keep talking to yourself. And this is more of kind of talking yourself down from a situation, because really what happens is when we get anxious, our thoughts make us get more and more anxious. Because if we let ourselves think about it enough, then we just the whole sky is falling. I mean, we really can work ourselves into a frenzy just by thinking about it. And so when you start to think about it at work, then you look at a situation and you start to think, oh my gosh, I'm going to die. This is not safe. Then you think, okay, wait a minute. Have we gone by all the protocols? Is there anything I can do differently in this situation? No. Then it's as good as it gets. We're doing what we need to do, and I need to stop thinking about all of the worst case scenarios in this situation. I need to also tell myself that maybe that worst case scenario won't happen. This is a tough one, because you are being, it is high risk, but it's kind of like, how do you get through these situations so that you're not creating more anxiety for yourself?
And Tammy, so many practices are coming up with so many great ideas and different ways to manage their practice, but what about maybe having them reach out to other practices to think of ideas they haven't? Because sometimes just talking to someone else and knowing we're all in the same boat, does that also help, or getting ideas from them?
Exactly. And I would think, well, everybody is stressed. So I would think of, how do you contact the office? Or maybe you organize a time where you have several practices do a Zoom meeting together or something like that. Or the practice managers start to talk to each other. Hey, what are you guys doing? I would be really careful though, because the fear and anxiety can take over pretty quick. So when you reach out to people, notice, okay, I want this conversation to be focused on how are we each doing? How are we doing things differently? What can we do? Are you doing something we're not doing that makes it better, as opposed to it going down the path of, oh no, I'm so scared. What's going to happen?
Right.
All of us are in the same boat and we're sinking. And so you have to be intentional when you reach out, is to look at, okay, I'm reaching out because I want us to brainstorm and come up with some novel creative ideas and trade secrets back and forth of what the other person is doing. Or maybe they have a contact who has supplied them with things that I don't know about. Yeah, that's a great idea.
So maybe more solution driven more than talking about the anxiety, talking about the solution.
Right. Because when you're in a crisis like this, it is pretty easy to have the fear just come up. And so if you recognize it, and I'm the same way. I mean, there's a little bit of fear in all of this. When you start to talk about it, it's easy for a conversation to go down that worst path scenario.
Right. And we really have seen some really creative ideas. We've been impressed with what people have come up with. So if they can stay on that solution path versus the stress path, is probably much better for them.
Right.
Thank you.
Yeah, and when I mentioned retail, what I meant, and maybe all medical offices are doing this now too, but I thought it was pretty clever. You know, they would build things around their cash registers so that there was a barrier, and they even changed, you know, people are changing their credit card, the way they're doing it, so that the patient is touching their card and not them. And they don't have to keep touching the button saying, yes, that's the right amount, you know. There's just a lot of practical things like that that minimizes risk, so that if somebody is working in the office, they feel much safer and secure because they're not touching so much stuff that belongs to a patient. And so, you know, I started to see that happen, and I thought, wow, I didn't even know you could do that with those credit card machines.
Yeah, people have gotten creative. It's been wonderful.
Yeah.
Thank you, Tammy.
Right, thanks, Tammy. Let's move on. We've got another couple of questions to cover.
Okay.
I'm a practice manager who has several physicians and other practitioners working from home and seeing patients via telemedicine, and they're all stressed. Can you help me address staff morale from a distance?
Yes. That's something that we have not had to deal with before. You know, when you think about how many times, most of our models of how do you build staff morale is when you're physically in the same office together and seeing each other. Or you maybe work remotely, but you get together for meetings periodically. And so this is very different. And I was thinking about that and thinking about how people just socially have been creating parties over Zoom, happy hours over Zoom, lunches over Zoom, you know, everything to stay connected even when you can't see each other. And in offices, you have relationships with all of those people, and some good, some bad, but you know, you can't, you know what to expect, and they are your family in some ways. And so I think if you're a practice manager and you want to maintain morale, is you want to have times where you all can get together remotely like that, and you're leading a meeting and finding out, does everybody have what they need to do their job? What are you finding that's stressful for you getting your job done? How can we better assist you? And having that feedback loop really goes a long way for morale too, because the person doesn't feel as isolated and they don't feel as alone trying to figure it out, because most of the staff has never had to do this either. And so they're having to learn technology that maybe they didn't have to know before. They're having to do things in ways they didn't have to do it before. And so you want to listen to whatever stressors come up and see if you can change your systems and do things that make the jobs a little less stressful. The social part, you know, even bad relationships are relationships. And no office has, you know, everybody getting along perfectly. But even for the most part, that person that you don't really like, you've come to, you know them, you know who their kids are, you know when they're stressed and when they aren't. They have become part of your tribe in some ways. And so I think one way to build morale too is to schedule maybe a lunch over Zoom or something like that, something that's more social, where everybody can do the water cooler talk that they probably have been doing in the office. And this is a situation you can't make any promises about how long it's going to go, but you can try to remedy those day-to-day situations that makes it easier and makes people connected and as a group, so that when you're back in the office, you feel like you've all been a part of a team going through something together, as opposed to everyone on their own trying to figure out how to make it work.
Okay, that's great. Thanks, Tammy. And the last question, I am not sleeping well. I'm unable to keep up with my exercise routine because my gym has been closed. I'm stress eating, contributing to my anxiety. How do I cope better?
Oh, I struggle with this one every day. My gym is closed. You know, the number one thing though is routine. And if you know you're pretty high stressed at the moment and you're not exercising, you're overeating, even a little thing of when you get up in the morning, you have a certain routine, and what that is maybe you mix together a vitamin drink, or maybe you take your vitamins and supplements because that's something healthy that you're doing for yourself that day. And you remind yourself, this is part of my routine to stay healthy and to stay on the right track. I would even get so structured because a lot of your day isn't structured now. And even if you're going to work and you're on the front lines, what you're responding to is not structured. Whereas there used to be a certain rhythm to what days of the week is the ED the most busy, what days of the week can you expect this to happen, or what time of the day. There was a rhythm that people learned, but there's no rhythm to this, and it's chaotic. So you individually, even if it's just 10 minutes of, okay, every day I'm going to get up, I'm going to spend 5 minutes reading something that's pleasant. I'm going to spend 10 minutes walking. It doesn't have to be very long, but the main thing is it's a routine and it's getting your body moving. Then once you get those things down, then look at how can you get apps and get an exercise routine going that you used to do at the gym. You're not going to do that day one. You've got to get your routine down and your basics down. And even if you need to pay attention to your food, like pre-plan it. If you know that you're overeating, pre-plan the night before what you're going to eat the next day, helps you stay on track. Now the sleeping thing, a lot of people are sleep deprived right now. And I would say of taking care of yourself, that is the number one thing that you need to tend to. And even if you're a person who you've never taken any sleep aids, you don't want to, if you've gone a bunch of nights with only sleeping a few hours at a time, then I would say talk to your doctor and let them know and come up with a plan, because chronic sleep deprivation exacerbates depression and anxiety, and even for a person who's never had psychotic symptoms can develop psychotic symptoms if they're sleep deprived long enough. And so I would think that that was the number one thing. You know, I will end this with just a little quick story. Is when I was doing my residency up at University of Rochester and I was in a hospital, I remember working with somebody affiliated with them that at one time, just because of the pressure of, you know, the long hours, the on-call, the crises during 9/11, because I was up there during that time too, and we were a triage hospital, and so it affected even a few hours away. Then it was a similar situation of you don't have time to sleep, you can't take time to sleep, but I would see people who would start to not even know where they were, and these were medical professionals. They wouldn't know, where am I supposed to go now? What am I supposed to do? How did I get here? And that's simply because the body does not operate, it stops functioning after a period of time without sleep. And so I would say that is your number one thing, regardless of where you fall on the stress continuum, is make sure if you are chronically not sleeping that you do whatever it takes to be able to get some sleep.
Okay, that is great. Thanks once again, Tammy, for your expert advice. We're always grateful for it here at MICA. We're going to wrap things up now. As always, our risk management department can help with any of your questions, be they emergent or non-emergent. Please call the hotline. It's manned 8:30 to 5 p.m. Monday through Friday, 602-808-2137, 602-808-2137. Thanks again, Tammy, and thanks to Anne and Sue.
Thanks
and we will, that's okay, no problem at all. And we will see you all soon. Okay, bye.
Bye-bye.